Welcome back, viewers. We all want to take care of our body and be healthy. After all, your body is the only one you've got. The right diet and exercise are great, but are you really listening to what your body has to say? Our bodies can have weird ways of telling us something is wrong, so it's easy to miss warning signs. Well, not anymore, because today we're going to talk about some weird ways your body is trying to tell you something might be wrong. Trust us, some of these methods are really out there, so keep watching until the end. Factor 1. Your handwriting changes. Yes, we've all had a change in our handwriting. At some point, otherwise, we'd all still be writing the same way we did when we were kids. We're talking about an odd change in your penmanship. An early warning sign for Parkinson's isn't trembling like you might think. It's actually changes in the way you write. One study showed that those who have Parkinson's are more likely to start a sentence normally, and then the words will get smaller and closer together. Parkinson's affects the brain and can cause muscle stiffness, which will affect the way a person writes. 2 diagonal earlobe creases. Take a moment to check out your ears. We don't usually associate the earlobes as an indicator of our health, but according to a few studies, it's worth taking a closer look. If you have a few creases in front of your earlobe where your ear attaches to your head, that could be an indicator of heart disease. A study from 2015 has linked the ear with heart health, and another study from 2016 also backs up this idea that these creases could be a warning sign to coronary heart disease. People who have these creases should take it as a warning sign, but this study found that those who have these creases on both ears are at a higher risk of heart disease. Make sure you're listening to your ears. Your heart will thank you. 3. Your waistline is expanding. Losing weight can be a long journey for many of us. But if you find that you're gaining weight quickly around your stomach for no apparent reason, it could be cause for alarm. If you've been indulging in sugary foods and ditching your exercise routine, then that's probably the issue. However, if you've been sticking to a healthy diet and exercise plan, and you're still noticing the extra pounds, it could be linked to heart disease or an issue with your liver. Fluid buildup around the waistline is an indication that something is wrong with your heart or liver, and is definitely something you should talk to your doctor about. 4. Your teeth are damaged. If you're having problems with your teeth for unexplained reasons, it might be a warning sign. Sugary drinks and acidic foods can do damage to the enamel of your teeth, but so can acid reflux. Even if you don't feel any heartburn, you could still have acid reflux that can wear down your tooth enamel, the strong outer layer of your teeth. If you often have a sore throat, a cough that won't go away, or a bad taste in your mouth, it's likely acid reflux. Don't let it go unchecked, because chronic acid reflux can increase your risk of gastrointestinal problems and eventually could lead to esophageal cancer. 5. You have a craving to chew ice. Sure, chewing ice can be satisfying, especially on a hot day. But if you find yourself craving ice cubes, it might be time to take a look at your diet. A study from 2014 established a link between chewing ice and iron deficiency. Experts believe that the act of chewing ice sends a signal to your brain, telling it to pump more blood to the brain. Since iron helps your blood carry oxygen, this would explain how a lack of iron would trigger this reaction, and why your brain would need more blood since it might be lacking in oxygen. Try chewing on some fish, meat, or legumes instead to boost your iron intake. 6. Jaw, shoulder, or back pain. If you just got back from the gym, this could explain the shoulder or back pain. But if you're experiencing issues in either the jaw, shoulder, or back, then something might be up. These symptoms can mean many things, but one of these could be heart disease. If you experience any other symptoms of heart disease coupled with this kind of pain, it might be time to visit your doctor. 7. White lines on your fingernails. If you have white spots on your nails, that's completely normal. But are your fingernails really white in color? Do they have white vertical lines running through them? This could be your body's way of telling you that something is going on with your kidneys or liver. White streaks, rigid nails, and nails that have a dip in shape can be a sign of kidney disease. 8. Stubborn hemorrhoids. No one wants to deal with hemorrhoids, especially the kind that keep coming back. Hemorrhoids are painful, and can be a warning sign of diseases like Crohn's disease, which is an inflammatory disease of the GI tract. Sometimes hemorrhoids can be mistaken as symptoms of Crohn's disease, and if left untreated, these symptoms will only get worse. It can develop into pain fissures, obstruct the bowel, or possibly develop into colon cancer. If you've tried everything and your hemorrhoids won't go away, schedule an appointment with a GI specialist as soon as you can. 9. You want salty food. Who doesn't love salty food? While we should all be limiting our intake of the delicious flavor enhancer, if you're craving salty food all the time, or at least more often than usual, you should look into it. Experts suggest that if you're adding salt to every meal, it could be an adrenal deficiency, otherwise known as Addison's disease. Craving salt is one thing, but if your muscles feel really weak and tired, or you have pain in your abdominal area, that salt craving might be more than just a craving. 10. You have problems with your hearing. You might think this means hearing loss, but that might not be the case. As we get older, a sign of aging is unfortunately hearing loss, especially if you work in construction or are a frequent attendee at rock concerts without earplugs. It turns out that a study from 2010 has linked hearing loss with chronic kidney disease. Experts say hearing loss is commonly associated with syndromal kidney disease, but this study links hearing loss to kidney disease in general. 11. Your emotions are all over the place. If you are experiencing extreme swings in your emotions, like the sudden onset of uncontrollable laughter or bouts of extreme sadness to the point of crying, you need to take it seriously. This is a condition known as pseudobulbar affect, or PBA. If you're falling victim to this condition, it's much more embarrassing and disrupting than it sounds. According to the experts, this could be a sign of MS. According to research, this condition affects 10% or more of people suffering from MS. This is a big one on the list that you do not want to ignore. 12. Your ears hurt after a big meal. Did you know your ears and esophagus are connected? It's true the vagus nerve connects them, and if you have stomach issues, this could explain the pain in your ears. Stomach acid can irritate this nerve, which will then irritate your ears and possibly other places. Research shows that you can have gastroesophageal reflux disease, or GERD, without experiencing heartburn. Talk to your doctor if your ears are burning after that spicy meal you just ate. Diet and medication could be a solution to this issue. 13. You have to pee all the time. Frequent urination is a common warning sign for those who are pre-diabetic or for full-blown diabetes. Side note, if you're pregnant, it could just be the extra weight pressing down on your bladder, and you're probably okay. But if you're not expecting, then this could be something to keep an eye on. If you're wondering, health professionals say that peeing 6 to 7 times daily is normal. So if you're in that range, that's totally fine. If you're going every 10 minutes, or have the urge to go, it could also be a sign of a urinary tract infection or overactive bladder syndrome. 14. Unexplained weight loss. If you haven't changed your diet or your exercise routine, this unexpected drop in weight might seem like a magical blessing. That's probably not the case. Unexplained weight loss can be a red flag for a number of issues like endocrine or autoimmune disorders or cancer. Ovarian cancer is a particular threat for women, but it could also be an early sign of pancreatic, stomach, esophageal, or even lung cancer. Have you ever had any of these symptoms? Did any of them surprise you? Let us know in the comments below. We'd love to hear from you. Thanks for watching.